PCOS, as the people commonly call as polycystic ovarian disease, this is basically a chronic hormonal imbalance, and it is characterized by a few couple of things with which the girls come to us, and that is first of all, that is oligomenorrhea, or very scanty flow, and ovulation means they are not ovulating, they have infertility, that they are not conceiving, irregular cycles, and some show the signs of hirsutism. It is a chronic hormonal imbalance which leads to this polycystic ovarian syndrome. It is a lifestyle disease. One may also add it to it because it is usually seen in the girls who have a strong family history of diabetes, and those who have a very sedentary lifestyle and little or very less physical activity and more of outside and junk food. This all contributes to obesity. This obesity actually results in the hormonal imbalance in the form of increasing of the luteinizing hormone, that is LH, and decrease in the FSH, that is the follicular stimulating hormone. Now, this hormonal imbalance leads to a wrong signal to the ovaries, because of which the ovaries do not form a particular follicle, and then it does not lead to the development of a monofollicle leading to proper menstruation. What actually happens that these girls develop very, very small ovarian cysts, and these cysts leads to the ovaries becoming more bulky with bigger volume, more than 10 cc, 15 cc, because of the wrong and the inappropriate signal going to the endometrium. The endometrium is not shed off, and hence the periods becomes irregular. So it is all a hormonal jeopardy which leads to this polycystic ovarian syndrome. PCOS is not a disease of a particular age group. If it is adolescent PCOS, the symptoms are a little different. If it is young adult PCOS, it is different. If it is perimenopausal, different. But the common, which most of all they come to us and present with and tell about the common symptoms, I'll tell you. First is that they are not getting regular cycles. They say that they have last had periods 2 months or 3 months or 4 months back. Second thing is they always say we have so much of weight gain. We have so much of weight gain. Third thing, what they tell is that they are developing a lot of acne, or rather we say pimples on the face and all. There is increased pigmentation around their neck, which we call it as acanthosis nigricans, and also sometimes they develop a lot of facial hair on the upper lip, on the chin. Sometimes they have a sort of male hormone increase, and hence leading to various sort of some sort of barrenness appearing on them, and hirsutism on the face. So these are the typical symptoms. And of course, a few of them, the childbearing age, they say we don't get periods and we are not getting pregnant because when we are testing on the ovulation kit, there is no ovulation occurring at all. So infertility is also very common. And in the perimenopausal ladies around 40 to 50 years, they say the periods are very irregular, and when the period comes, it doesn't stop for 20-25 days, and they land up in anemia. And when the sonography is done, it is showing that the ovaries are very bulky with multiple cysts, endometrium is too much of thickened, and it's very, very difficult for the patient with this disease. First of all, one has to remember that PCOS is around 40% common in Indian females. Out of 100 females, 40% are suffering from PCOS. So what is the reason? It is a chronic disease. It is a lifestyle disease. It is a disease that has to be very, very carefully dealt with. The girls have to be explained about their disease in proper way. This is the thing that is happening in your body, and because of these symptoms are coming. Now, The treatment includes proper diet and lifestyle modification. Lifestyle modifications: try to get up early, be less on the phone and the social media, give time for your body. Physical exercise around 40 to 45 minutes at least 6 days a week is required. Every time you see the carbohydrates, you have to cut them, have less craving for the sweets and the outside and the oily food. Maintain a very, very healthy lifestyle. Make groups of friends who are more into physical activity and less on the social media, because more sitting more time on laptops and tabs and mobile makes your lifestyle even more sedentary and more prone to the various other complications of polycystic disease. Of course, tablets are there, but the tablets will help you to tide over for small time. But then again, if the body and your lifestyle is same, then this problem will never end. So first, counseling of the patient is very important. Pay a lot of time for explaining the disease, changing their lifestyle, refer to a proper dietitian who will help them out. And then comes the role of medicine. Now, there are a lot of medicines, then they all conceive very fast or their PCOS settles very fast. I have seen patients who have been so dedicated, in 3 months, they lose 6 to 7 kgs and they come back to me saying my periods are now regular and the symptoms are gone. Of course, there are OC pills also, which contains ethinyl estradiol and CPA. But we always tell them that medications are always secondary. You should always concentrate on your lifestyle management. Healthy lifestyle can 100% control PCOS. Reversal means, like, if I am diabetic, I require insulin. And I require insulin because my pancreas are not forming insulin. So my body requires insulin, so I have to take insulin. Similarly, if I'm a thyroid patient, there is a decrease in the thyroid hormones and hence TSH is raised. So I need thyroid hormone for my body. Similarly, but for PCOS, if you have a healthy lifestyle, if you are very, very adamant about your cure, it is 100% controllable, and sometimes in few cases it is actually reversible with this type of lifestyle changes.